severe illness due to COVID. So three things I wanted to touch on about the three conditions that we commonly see: anxiety, delirium, and depression. So first of all, with anxiety, what we're seeing is some severe anxiety that's associated with what we call air hunger that we see with patients who have COVID pneumonia. So these patients, they suffer from kind of almost a nonstop feeling of suffocation as their lungs are filled and the body's trying to recover and medications are trying to take effect. They're unable to take a deep breath like we all do kind of periodically throughout the day. When we take a deep breath, we do several things kind of without even thinking about it. We lower our heart rate, we lower blood pressure, we do kind of a full exchange of oxygen, and this all reduces our stress. So when you have a severe pulmonary illness, you're not able to do that. And so this is one of the most difficult things I think to witness is when patients have this, because you want to help them. And, our first instinct is always to tell people with anxiety, take a deep breath. Well, they can't do that. So we have to kind of move past that. And then we consider anti-anxiety medications. But many of the medications that we would use for fairly rapid relief of anxiety, they have a potential to cause sedation and even reduce respiratory drive. So we have to be extremely careful in these cases, and we don't always feel like, we're giving adequate relief because we're trying to balance not making the condition worse. So that's one of the things that we're seeing. The other condition that we often see in severely ill patients, and not just those with COVID, but we see this in any kind of severe medical illness, is delirium. And delirium is a sudden change in attention and cognition. And by cognition, I mean things like disorientation, being confused about where you are or what date it is. And with this confusion and poor attention associated with delirium, patients can also develop visual hallucinations where they see things that aren't really there, see things in the room that aren't there. They can have auditory hallucinations where they hear conversations and things that really aren't happening. And because of all this confusion and the hallucinations that can occur, some patients will even develop delusions. And it's pretty understandable if you think about it. If you're disoriented and you're in the hospital, but you don't realize that you're in the hospital, you think you're at home, then you're kind of wondering, well, why are these people coming in? Why are they moving things around in my room and messing with my bed sheets? And so that can cause agitation. And that's something that we try to address because we don't want patients to hurt themselves, to get up and fall or hurt somebody else and trying to protect themselves. So this is a complicated condition that we try to manage. The underlying treatment, or the definitive treatment for delirium, is to treat the underlying medical condition, whatever that is. If it's COVID, if it's heart disease, if it's whatever the condition is, it's brought the patient into the hospital. Common things are like urinary tract infections or other severe infections that can happen. But we want to treat the underlying condition, but then we want to very carefully try to treat the psychiatric manifestations of delirium, which is what I just described. The third thing is sometimes we deal with depression with patients with COVID. This is especially those patients who've had a long debilitating illness. So someone with COVID who's been on the ventilator for several weeks, they've been, probably mostly unconscious, not moving certainly, and they lose some physical strength. Sometimes they're not able to walk, and it kind of depends on their physical state before coming to the hospital. But it's not always in just elderly patients. Sometimes we see this in middle age or younger. And then when they start coming about and they're off the ventilator, and now they're having to deal with the fact that, wow, I've got a big disability I need to overcome. And what's going to happen? Am I going to be able to work again? Am I going to be able to be independent and go home? Will I be able to care for others like I used to? So that's something that we see quite a bit and deal with in the hospital as well.
Thanks, Dr. Gleason. Dr. Moseman, if you wouldn't mind, maybe you can add from your perspective as well, and then we'll open it up for questions.
Absolutely. Thank you, Ondria. I'll start by piggybacking off what Ondria said. So certainly we've all, over the last, 18 months now, have been learning about COVID-19 and how it impacts us, trying to make personal decisions about whether we, get vaccinated, how we do precautions, how that works. There's certainly recommendations that physicians have had that are important. And so what I've seen in the child and adolescent population is certainly with the first wave, even probably with the Delta variant, this is an illness which children and young adults seem to have a little more protection against. They tend to get less severely ill than adults or older generations have. And we got to remember that all viruses are different. That being said, so in the practice of those patients I've seen that have gotten COVID, I'd like to talk about that and then separately talk about the impact on child and adolescents is just as far as what's it like to be in quarantine, what's it like to do distance schooling, what it's like, all the things we're doing to try to contain the illness and how that puts pressures on families and kids. But the acute illness itself, short haul symptoms, a lot of kids will get sick. It will feel like a viral bug or those kinds of things and get better. I do have a subsection of longer haul patients who continue to have difficulty not only with smell, but I've seen depression, anxiety, irritability, other kinds of things that are happening. So again, I have 2 teenagers at home, both which are vaccinated. And so as you're thinking and weighing out, in Oklahoma, we have a relatively low vaccination rate among adolescents that are capable of getting the shot at this point. And so what I would say is to always weigh out, not just will they get to the hospital with the illness, but in getting COVID, can there be longer term symptoms, both physical symptoms and mental health symptoms? I'm certainly seeing those mental health symptoms in my practice. From the other standpoint, the last 18 months running eating disorder unit and then seeing adolescents in outpatient clinic has been incredibly stressful for families and for kids. My inpatient unit that says eating disorders, my outpatient clinic, trying to find therapists, people are incredibly backed up. Beds are backed up. This has created an incredible strain on the mental health system, just as we're dealing with distance schooling and quarantines, dealing with just kids not doing their normal kid things. And so the simple way I tell families to look at this is that a young kid, a grade school age kid, an elementary, middle school, or high school, they should be able to go to school, sleep, have friends, do the things that they enjoy doing. And if you start to notice that they're having irritability, lack of enjoyment, things, grades are going down now that hopefully we're back less in more in-person schooling, and things that would look at depression or anxiety, then please get help. But even when families are getting help, I'm running into the fact that therapists and doctors are backed up, just like ICUs and other kinds of things are, from the load that this is having on families. So I like to look at it from those different things, but what happens if you actually get the illness, as well as what's the impact on all the mitigation efforts that we're trying to do. And I've seen it take an incredible impact on both, young people as well as their families. And that has led to issues with just dealing with illness as well.
Thanks. Yeah, I think the issue of isolation, social isolation, is one that is probably going to have long ranging impacts that we've just barely begun to understand and really scratch the surface of the impact this is going to have on our communities for months and maybe years to come. Would you, I guess, Lauren, what I'll do is let's open it up to our colleagues in the media and let them ask whatever questions they'd like to ask of Dr. Gleason, Dr. Moseman.
Great. Who'd like to go first for questions?
I'll go ahead. Hi, this is Abigail Dye with Fox 23. Thank you for having us all here today. I was just wondering, so when we are facing issues with COVID and more so the social issues with it, are we seeing a rise in alcoholism and substance abuse? Is that something you can speak to?
Yeah, I can take that. What we are seeing is there has been an increase in substance use, and it's tended to be particularly in those people who've had issues with substances previously. So not as much as new onset, alcohol dependence, that kind of thing, but more of a it creates a relapse scenario for many people. There was also a very interesting study that just came out looking at substance use in college age students. And I'm forgetting where the study was at, but it was very interesting because with the shutdowns, there haven't been all the parties. So not a lot of binge drinking. The alcohol use among college students actually dropped, but marijuana use spiked considerably. And so I think it's going to be interesting to see if once things open up again, if the alcohol picks back up to the usual numbers, and if the cannabis use continues, because as you know, cannabis is more readily available now. So anyway, I thought that was a very interesting thing.
Thank you.
Dr. Moseman, I'll ask you a question. Talk a little bit about family dynamics. So you talked a little bit about the impact of social isolation on kids. Can you maybe speak with a little more detail around what you're seeing or what your colleagues are seeing, relative to the situation of kids not going to school, being isolated this past year via homeschooling, et cetera, and the impact that's had both on the children, but also on the families?
Absolutely. Sometimes real life numbers or examples. So I've been here in the health system for almost 18 years now. And in the eating disorder center, we take young women patients from across the country who come here to psychologically, nutritionally rehabilitate. And we're a well-known and well-regarded program. Oftentimes stress follows stress in school. So things get worse in the fall and in the spring. In the spring, we tend to be busy. We often run a waiting list. In the last 18 years, we have 15 beds for adolescents from across the country, and it's not uncommon to run waiting lists in the 12 to 15 range. April of this year, I had a wait list of 28 patients waiting to get in the hospital from across the country. So for me, it's a real example of how that works and how that goes. And it is sort of what I call the shrapnel results of COVID, which is, kids thrive on sports and social interactions and family and being in person school and doing those kinds of things. And so I think there's been an impact at home, for those people that choose homeschooling or those students that do well with homeschooling. I think they do well. I've noticed kids with ADHD, anxiety and mood issues, that the isolation and that, homeschooling and video things, the not normal social interactions, not normal social outlets has caused to increase stress levels. So as Ondria would have said, anytime you've increased stress, you're going to have more eating problems, more substance abuse problems. Those things, happen. You can make arguments that certainly it's worth it when you're saving lives by doing quarantining and by keeping people safe. I know for my own kids at school, when I have a mom who's in her 70s, of trying to make sure until she can be safe or vaccinated, that we're making sure they're not bringing stuff home to hurt her. And so it was seen as a sacrifice, but it still definitely has an impact. And I think we've seen that in families. It's not unusual in the city of Tulsa to have waiting lists for very good therapists, but those waiting lists are 2 to 3 times as long as they have been, which again, for people in crisis creates more difficulty when they're unable to get the help that they need.
Thanks.
And a question for Dr. Gleason. Any thoughts on the changing mental health impact for healthcare workers now that our patients are younger and our mortalities are also trending younger?
Yes, the pandemic has been very difficult on healthcare workers. Folks that work in the hospital, intense healthcare settings, they have a stressful job anyway. But then add on COVID, and I think what's been one of the things that's been so difficult about it for everybody is so many unknowns and the unpredictable nature of the illness. Early on, I think we were told that, okay, it's going to be the elderly there or people who have or immunocompromised that are going to really be struggling. But then we would hear of some young person who, died suddenly from COVID. And there's been, all the coagulation problems that cause blood clots and strokes and just a range of problems for all ages. And I think that's very hard for healthcare workers to see that on a daily basis. And then you're worried about the patient, you're worried about spreading it to other people, you're worried about catching it yourself, you're worried about taking it home to your family members or other people that you interact with. And it's kind of a new world for all of us. We haven't had anything like this for, decades where it's been kind of a fear like this. And I think that just makes it hard every day. And then, just the day-to-day challenges of caring for patients too. There's a lot more time involved in, putting on appropriate PPE for each patient and being careful with how you do it and thinking about it and making sure you have enough of PPE. I know the hospitals early on and the clinics were all, trying to, keep counts and making sure that they had enough, and they still do, but there was a shortage, at the beginning. Also, there's communication barrier. And I think that's been very frustrating for me as a psychiatrist, and I bet Scott could speak to the same. But when you're having to see a patient and wearing a mask, you just lose so much with facial expression. And then some patients are hard of hearing and you put a mask on them and a mask on you. And it's made it a lot more difficult to take care of patients and to feel really good about what you're doing.
Thank you. Anyone else with questions? Corey?
Lauren, could I make one other comment?
Of course.
I also wanted to touch on, it's not just the nurses and doctors, but the other group that I think's been affected by this are other people in the hospital, the custodians of food service that have been going this whole time. And then even clerical staff that are, admitting patients and checking people in. We all have the same fears. And so it's just affected so many people so broadly.
That's a good point. Thank you.
It's Abigail Dye with Fox 23 again. Hi. I was just wondering, so when we're speaking about depression, we spoke on it with COVID patients in specific. Are we seeing a rise in depression in general with COVID and non-COVID patients, just like we were kind of speaking earlier, because of social distancing and things of that nature? And if so, are we seeing an increase in things like self-harm, suicide, those really life-threatening type of things?
I certainly can speak at least on the adolescent and even the young adult side of things. I think what's been so hard as a physician throughout this with so much information is that we do our job based on data, and data changes. And that can be frustrating, I think, with the general public feeling like people are changing their mind, when the truth is, when you're trying to stay in front of illness, that it can be difficult. And so, the hard thing for me to operate with that is that, mental health studies and those kinds of things, people are trying to figure out who needs to be on vents, how this is impacting people. So the studies that look at depression, substance abuse, et cetera, they're probably still, months and years down the line, and they might be done retrospectively as we look back on normal numbers and what happens as we're still in the midst of a pandemic. So I would certainly say organically, yes, I feel it. I can't refer people. I'm busier than I've ever wanted to be. There is definitely an increase demand for mental health services and probably common things being common. A vast majority of that would be those people that have just been infected, impacted by quarantining in school and fear and all those other kinds of things that happen. So though COVID is a very worrisome thing, it's affecting, a substantial portion of our population. That population, which is getting severe enough illness or illness that sticks around that causes mental health issues, is still probably relatively low. So it is one of those things where I think the things that we're doing as a result, quarantining, fear, et cetera, has exacerbated, not going to school for the kids that I treat is certainly exacerbating those things. I certainly, as a physician, still think that what we've done has been worth it to save lives and to mitigate, to keep ICUs open so that other people can be treated. But there is an impact, and the mental health impact is big. And I think we'll, as Dr. Robertson had said, we'll experience it for months and years to come. Probably, this thing has got to get under control before we can start to look to see the total impact. But organically, I feel it. I'll be interested to see what the numbers, pair out, and then how that looks over time.
Dr. Gleason, one question I have for you is, how has the pandemic impacted our learners, our students that are, heading down the path of a career either in medicine or in nursing or any one of the health professions? What have you seen from the university's perspective?
Yeah, one thing on the education side, I think that was really very good is that we were able to switch to virtual modalities so quickly for our medical students, physician assistant students, resident physicians. For any didactics, we were able to quickly just go to Zoom, and that was extremely helpful because we could avoid having large groups together and spreading illness. So I think that's been helpful. I will say though that students that they were assigned for clinical clerkships and experiences. I think that was really hard for them because we tried, at least in psychiatry, we did have the option of going virtual for patient care. And we did do that for some of our students for their clinical rotations. But, it's not the same as being with a patient, being able to see them, full on. But we did the best that we could. And now we are back in person, but, with the masks and losing facial expressions and those kinds of things. But we are doing the best that we can to keep people safe and still allow them to learn the best they can and be prepared for their career.
And I got a question via the chat from Corey Jones with the Tulsa World. What do we need to be focusing on to try to mitigate the long-term harm of the mental health toll the pandemic is taking as we continue forward?
That's a good question. I think, what happens is whenever you have a system under stress, it reveals more things about that system. So any of us have worked in mental health, especially in the Tulsa, Oklahoma area, have recognized that there is a need. As a child psychiatrist, when there's a need for 20,000 child psychiatrists across the country and there's 7,000 board eligible child psychiatrists, it's been a chronic need. And sometimes what I hope that this highlights, and anytime that an already sort of at-risk, specialty is put under pressure, it really becomes evident that there needs to be something done. So my hope is it shined a light on things so that we recognize, the physical and mental tolls, so that we put more time, money, and resources into mental health so that even robustly when things are better, it's working well, and then it can sort of stand, the stress test that this has been. The minor positives to Dr. Robertson's question is, I almost hate to use the name, but there's something in medical training circles called the Fossey effect, which is there seems to be in young people who are, let's say, at earlier stages, so high school, college, an increased interest in medicine, that they've seen the impact of this. And so, some of the benefit might be that people have recognized the importance of medical professionals and what is necessary. They've decided to pursue careers in medicine. I understand that some medical school numbers and those kinds of things are up as far as applications. And so my hope would be, if we're going to get through something like this, can this shine a light on those things that we can do better? That once things been under stress, that we can understand this is a really need, this is important during regular times, especially during crisis, and this is something we need to bolster.
Yeah, and I might add too, there are some things I think we can do personally to try to mitigate some of the effects of COVID and the psychological issues. one is to, even though I know we're talking to news folks, but for folks, we tell, don't just glue yourself to the news, because it can be distressing for some people to, watch it 24/7, and some people are on constantly. And it's what's happening is they are seeing a lot of things that are concerning that are out of their control. And it does create this psychological distress when you are presented with problems that you can't do anything about, and you would like to do something about them. So that's one thing. Another thing is, I always tell people, if you can, get outside. That's one thing. We've been, kind of locked down a bit. You've been, isolating. But there really isn't much reason, if you're able to not be outside and get some exposure to green space. I think when you are outside in nature, it really does a lot for your mental health. So, and your physical health. Get out, take some walks. That reduces anxiety. It improves mood, just even in the short term. But you start adding that up day after day, it can make a big difference. And then also talk to people in your circle that are close to you that are supportive. So if you have somebody that, a spouse or a family member, somebody that you trust and can talk about your feelings, use those folks. Clergy, reaching out, addressing your spiritual needs. Those things are really important right now. And that has been another effect with, I know early on churches were closed and a lot of people had, struggles with that, although churches were pretty quick to go online too. But those kinds of things are important, addressing physical health, mental health, spiritual issues. Those, they all work together. So those can be helpful.
Thank you. If there's no other questions, I think we will close for today. Thank you, Dr. Gleason, Dr. Moseman, Dr. Robertson, for your time today, and to all of our reporter partners. If you have any specific topics that you'd like us to address for future weekly updates, please send them to me or Saban.